Hi, I'm Dr. Ramah Wagner. I want to share with you a little bit about scoliosis today, because boy, I wish I would have known what I know now and options that are out there. There's something called CLEAR Scoliosis, and even in a few short months, you can offset some of the progressive and degenerative parts of what scoliosis can do. In school, chiropractors are taught to basically do palliative, pain-relieving care for the scoliosis patient. We aren't really trained highly in how to adjust. In fact, some of the stuff we're taught is really, now that I understand it better, is really contraindicated. But most of the time, the best we can do as chiropractors is relieve pain for a short time. Until one day, I was out at a seminar, and it was for functional medicine, and I saw a card that had CLEAR Scoliosis on it. I asked the doctor, what is CLEAR? What I'd like to show you now is what a typical patient would experience with their hand-tailored CLEAR Scoliosis 2-hour protocol.
What we're going to do is take pictures in the beginning and then take pictures at the end with her posture, put it through our program, and it tells us what specific areas that she's improved on and what all the hard work that she's done and put into the program and all the improvements that she's made. So what happens after your first day here, after we do your exam and your x-rays, Dr. Ramah will take your digital x-rays that we do and put them through a program called PostureRay. PostureRay is a really awesome program that she's able to find out specifically what degree your curves are. So once we get that information, it gives us a line-by-line analysis. It shows us what your spine should be and how it differs from what it's supposed to be. So it shows us what your degree of curves are. Dr. Ramah takes this information and she builds a specialized treatment plan according to what you need. And everything is specific towards your x-rays. So off this PostureRay analysis, we're able to build a specific CLEAR program to you. You're here for the 18 visits, for example. After those 18 visits, we give you CLEAR exercises that you can do to take home. And then we usually see you about every 3 to 4 weeks for just a basic adjustment after that.
The first part of the 3-part CLEAR process is with the mix. The mix breaks up the scar tissue, the ligaments, the tight muscles, and it pumps fluid into the disc. With the mix, there's many machines we use to get the spine ready for the adjustment. We call it the fix. So during that time, we'll do the wobble, which will pump fluid into the disc. We will do wall traction that will help with the neck to get fluid into the disc. We'll have MDP, which will break up the scar tissue, the adhesions, the fixations on one side, often in the scoliosis patient more than another. And it'll also get the body pliable and ready like taffy so that when they get the adjustment, they're ready to go.
We're going to go front to back, so we're going to curve our back and then go forward. And what's cool about this wobble chair is actually going to warm up your spine before we start getting things moved. And then afterwards, we go side to side. She'll also do where your hand's on your side and then your other hand's over, and we push over. This is the cervical wall traction. This is part of the mixed section of the Scoliosis CLEAR program. What we'll do is we'll set it up right to your height. I'm gonna step in and just kind of show you how it works here. We're gonna put this right underneath your chin. This goes right underneath like where the crook of your neck should be. A lot of scoliosis have straight necks, so this helps with that. We're just gonna warm up your neck region. Alrighty, Angel, so what we're gonna do is I'm gonna have you lay right on your back here with the crook of your neck right over this nice little cushion to make you comfortable. Okay, I'm just going to scoot this under a little bit more. Perfect. What this is mechanical drop piece, or MDP is what we call it here in the office to make it short. I love this machine because what this machine is going to do is this whole machine is going to vibrate while she's on the MDP. And what this does, we do it right before the adjustment. This is part of the mix. It's 15 minutes, and we're going to add a weight to her just to add for extra traction. She's gonna do the same thing here with this MDP. This MDP is gonna have a special frequency vibration, and what that does is it loosens up the disc, turns it into like a gel type consistency, so that way when she goes to adjust, she can get a lot more movement done. So what we're gonna do is go ahead and turn it on here. So what this is going to do, this is going to work all the way from her cervical or neck region down to her lower mid back or thoracic region. So a lot of people have the curve that goes up into their neck and even their thoracic region. And what this does is it loosens that whole area up, so that way when she goes to adjust, she's able to get more movement and more of an adjustment done through this specific area.
The second part of the treatment, and I think the most important, is the fix. That's that structural adjustment that's going to be derived from all of the x-rays that were taken digitally, so that we know different angles of the spine, different ways that it happens in different directions, on how to work with the whole spine for the scoliosis patient.
Alrighty, so I'm going to have you go ahead and lay face down on the table. This is part of the fix portion of the CLEAR Scoliosis. This is the adjustment part. I'm going to do some core stim right along your spine area. Get everything nice and loosened up before Dr. Ramah comes in. And then when she comes in, she'll do an exercise that is specific to your x-rays every single time. And then we move you right into the set, which is the vibration plate.
The third part to the CLEAR Scoliosis protocol, and the last part, is the set. It's just like the name sounds. We try to set the adjustment and all the work we've done into place, to lock it in, to lock the derotation process that we've been working on. See, we're not just trying to work with the bends. The spine is three-dimensional. So in the set with the chair, and also at the final part, what you'll see is the vibe plate with weights, where usually you'll see an HLA or different contraptions built specifically for the person to, again, lock that adjustment, lock all the work into place.
And I just make sure everything's level, and we're going to get her set up. She'll sit in this chair for about 20 minutes. What we're going to do is get her all set up, and then before I start the machine, I always go get Dr. Ramah. Dr. Ramah examines the x-ray and the analysis that she had done previously to make sure that the straps and everything are in exactly the right place. And we want it tight and comfortable, but tight enough where we can make a change over the course of however many visits that are prescribed to you. Everyone's a little bit different, but we make sure that while they're in their chair, they feel as comfortable as they can be. Do things like the chair starts to relieve pressure off their spine that they feel, just because we strapped them to a chair. Okay, so this is the vibration therapy plate. This is the set portion of the CLEAR Scoliosis. They're on here for about 15 minutes. This is also my favorite part of the CLEAR Scoliosis program. So what I'm going to do is have her step right up on the vibration therapy plate. With scoliosis, they do specific weighting. So we're going to go ahead and add the weights for her. Now, Dr. Ramah looks at the x-rays and does x-ray analysis. Specific issues for every patient are a little bit different. So if they have anything with their neck, or if their curve is a specific way, we're going to add weights to help make a change in their spine over the course of their treatment plan.
What's neat about CLEAR Scoliosis is it's just three simple ingredients: the mix, the fix, and the set. The mix breaks up scar tissue and adhesions, the tight muscles, the ligaments, the tendons. It gets the disc plump and ready, full of fluid. For the fix, the adjustment that's a structural change, very different than the average chiropractic adjustment, derived from a bunch of different x-rays taken to see the three dimensions of the spine. And then thirdly, the set, where we set in all the derotating process that the CLEAR Scoliosis visit experienced. During this process, you'll have home exercises. You'll be asked to do certain things and not do others, but it's pretty easy. Most people find it's a very comforting process.
So usually you get this towards the end of your care. These are exercises that you can do the rest of your life, and they're very specific to your spine. So if you have certain curves that go one way, we want to strengthen certain areas to help bring your curve the other way naturally to make it straighten out. This will help make your spine even stronger, to help make tense and areas that are bothering you with CLEAR get a little bit better. Alrighty, so what we're doing, we have a special Scoli brace And we're gonna scan the patient's body. Some people have severe enough curves that they actually need a Scoli brace. What this program does is it's gonna electronically fit a Scoli brace to their spine. And then we send this off to the Scoli brace company. And the Scoli brace company will send us their customized Scoli brace.
Don't wait. You don't have to live with the progressive, degenerative parts to the scoliosis. You can do something about it. It could change your life. You don't have to live with pain. You don't have to live not doing the things you've wanted to do. We can help. Call us. Don't wait. Bring me your x-rays if you have them. If you don't, we'll take care of that here. But let's start this process and start this conversation about what CLEAR Scoliosis can do for you.